Hi guys, Ross here from Hogan & Mitchell Physiotherapy, and today I'll be covering 5 things you need to know about an ACL injury. So I've picked these topics. These are often questions we get asked that are not always covered by clinicians when talking about ACL injuries. Once you know this information, you'll be in a better place to make a decision about what to do. So let's jump straight in. So, number 1, for those that don't know or haven't been told or haven't spent hours on Google learning this already, ACL stands for anterior cruciate ligament. So, this is a left knee, this is the front of your knee, this is the back of your knee. Your anterior cruciate ligament is that one in there. So, a ligament attaches a bone to a bone and limits movement. In the knee, your ACL is pretty much responsible for providing a restraint to rotation of your shin bone on your thigh bone when we walk or move around. So it pretty much stops that from happening too much. Number 2, mechanism of injury. How does an ACL get injured? So usually this happens with what's called a valgus collapse, and it looks like this. So if this hasn't happened to you, then it's probably not your ACL, which is a good thing. Usually an ACL injury occurs in non-contact situations when changing direction or missing a footing when you're landing on something. But it can happen in tackles, in team sports, often contact sports. You can have a partial tear or a full tear, also called a rupture or a grade 3. Which one you have will usually influence how you recover. People can often feel quite normal fairly soon after an ACL injury when the swelling goes down and they can walk pain-free. Number 3, in the general public, an ACL injury can sometimes go undiagnosed or misdiagnosed for a while, as none of the tests for it are very good, and people usually just get on with life. Often a bigger picture is needed where we listen to your specific problems and symptoms and looking at what you can do and what you can't do. Persistent giving way is usually the lingering symptom rather than pain, but each time your knee gives way, it can make it painful again. 80% of ACL injuries report a classic history of a specific incident which was followed by large swelling across the whole knee, not just one part of it, often quickly, sometimes within 20 minutes. Number 4, surgery is not the only option. Historically, ACL ruptures have been offered a surgical reconstruction where they take another part of your knee, so sometimes your patella tendon, which is this bit here, or your hamstring tendon, which is on the back of your knee, and they insert it back in to create another ligament again. Although now we know that people can live without them. Loads of people do, but just avoid or limit how much jumping and twisting they do in activity or sport. People without ACL ski, play football and basketball, but they just take it easy. Straight line work is usually okay, like running, cycling, swimming, weightlifting. There is a big movement now worldwide where clinicians are trying non-surgical options and having great results. The main question to answer is, what do you want to be able to do again? How competitively and how intensely? And finally, number 5. The recovery period with or without surgery is long, but needed to give you the best chance of having a good outcome. It's usually a few months at least without surgery, and 9 to 12 months with surgery. This rehab includes getting much stronger by being in a gym and learning to trust the knee again in different scenarios, all of which takes a long time. The true marker of recovery from any injury is not thinking about the injury, which can be hard for some people with an ACL injury, but good rehab usually helps minimise the risk of this becoming an ongoing problem. If you can avoid it, don't skip the rehab, as you'll regret it further down the line. It can increase the risk of another different injury and can make you stop using your leg normally and get weaker over time, leading to more problems and an increased likelihood of getting different knee pain. So, there you go. 5 things you need to know about an ACL injury. If your knee is still giving way when you twist on it, and you don't have trust in it, and you've had a decent injury to it a while ago, where it swelled up quickly across the whole knee, chances are you may have an ACL injury. If you or someone you know has had an injury and isn't sure what to do about it, get in touch. Fill out the contact form below, give us a call, or even book an appointment online or via Skype. Or check out more of our videos.